Welcome back. This next section provides some answers to typical questions relating to taking steroids. It's easy to feel concerned about taking steroids for asthma, especially when there is lots of information on the internet. So here are the facts behind the most commonly asked questions. You may wonder, why are people with asthma prescribed steroids? Steroids help to calm inflamed airways. If you've been diagnosed with asthma, you might be prescribed or given steroids in 4 different ways. Your Preventer inhaler, taken every day, contains steroid medication and helps to manage your symptoms. If you take it as prescribed, it helps to reduce your risk of an asthma attack. If your asthma symptoms become severe or you have an asthma attack, your doctor may give you a short course of steroid tablets. The dose and length of the course would depend on your age, the severity of your symptoms, and how long it takes you to recover. A very small minority of people with severe asthma, usually under the care of a hospital consultant, need to take a small dose of steroid tablets for longer periods, perhaps months or years, or may be given an injection every few months. To treat a severe asthma attack in hospital, steroids can be given intravenously. Another common question may relate to whether you should stop taking steroid tablets when your asthma symptoms get better. Steroid tablets are usually prescribed for 5 days and continued until you're fully better. It is important that the tablets are taken as prescribed and you don't stop taking them before the course is finished or you're fully recovered. If you finish a short course of steroids but you're still not feeling better, see your doctor straight away to review your treatment. You may need a longer course of steroids. You may wonder if your steroids can cause side effects. Like all prescription medicines, steroids can cause side effects. But it is important to remember that most people who take them won't experience them all, or even any. The steroids in your inhaler are unlikely to cause many of the side effects because the inhaled medicine goes straight down to the airways where it is needed. Very little is absorbed into the rest of the body. Another common concern relates to the likelihood of catching infections because of steroids. For a small number of people, a short-term course of steroid tablets can lower the body's immunity to infections, such as colds. You might also be worried about the side effects from steroids. It's important to talk to your doctor about your concerns. Whatever you do, don't stop taking your inhaler without discussing it with your doctor first. Some people find having to take inhalers can get in the way of life. If that's the case for you, talk to your doctor about the least disruptive way to take it. For example, if it's that you find it inconvenient to take medicine twice a day, your doctor might be able to prescribe a medicine you take just once a day if your asthma is well controlled. Some people may feel embarrassed taking medicines in public. If you are self-conscious, ask your doctor whether there's a more discreet device you could use. And remember, if you use your Preventer inhaler regularly, you're less likely to need your reliever inhaler anyway. Remember, your Preventer inhaler contains a dose of steroid medicine that controls the swelling and inflammation in your airways. The protective effect builds up every time, cutting your risk of asthma attacks and making you less likely to have other symptoms, such as breathlessness, and less likely to need your reliever inhaler. If you stop using the Preventer inhaler for a few days, the protection it gives you will start to break down, raising your risk of an asthma attack. That's why it's really important you use your Preventer inhaler every day. Your Preventer medicine works in the long term to lower your risk of having an asthma attack, so you should take it even when you feel well. If you take your Preventer inhaler regularly, it should reduce your need for the reliever inhaler. I hope we have addressed some concerns you had around your medicine. But of course, it's most likely that you have many more questions. So it's important that you discuss these with your doctor. Thank you for your attention and see you at the next video.